All right, Nancy, you cool with admitting folks and monitoring the chat?
Yep, and I just started recording.
Then I think if everybody's all right with it, I'm going to get started. So hello, everyone. Welcome to our first Nurse Innovation Fellowship Program information session for 2025. I'm Marion Leary. I'm the Director of Innovation at Penn Nursing and one of the leads on this program. Along with my colleagues who are listed on this slide, some of which are here, whom are here today, and then I'll have them introduce themselves in a second. I just want to point out that this program is supported by Johnson & Johnson and powered by Penn Nursing and the Wharton School. So we're really excited to have you all here and can't wait to share information and answer your questions. So this is our full team for this year's 2025 Johnson & Johnson Nurse Innovation Fellowship Program. I'm going to let my colleagues who are here introduce themselves quickly. Nancy, you're up.
Sure. Hi, my name's Nancy. I'm the Innovation Project Manager working on the Johnson & Johnson project under Marion. So I am kind of the person who is in your inbox with reminders and booking travel and sort of trying to keep people on track and on deadline.
Yes, and you will hear a lot from Nancy if you go through this program. I'm going to go to Hiam and Kate first and then Michelle. So Kate, do you want to introduce yourself?
Absolutely. Well, Happy New Year, everyone. Kate Fitzpatrick. I am one of the consultants for this program. I've been with Marion and team since the outset. Super excited about this program and that we're, moving into our next cohort. It's hard to believe. So not only being an advisor and consultant to the program, I also was fortunate to have two of my executives go through the inaugural cohort and just to see the impact it's had on them and the work that continues because of their experience here. Super, super exciting. So welcome everyone. And I'll turn it over to Hiam.
Thanks, Kate. As Kate mentioned, it's amazing the impact that we're seeing. But my name is Hiam Nadal, and I'm the current director for the Center of Innovation and Care Delivery at Mass General Hospital, in addition to being a consultant. And I was lucky enough to be the first inaugural cohort of nurse innovators with Johnson & Johnson. And I can't tell you how much credibility and impact it has on my life and my career. So welcome.
Thank you, Kate. Thank you, Hiam. Michelle, would you like to introduce yourself?
Yeah, thank you so much. I'm Michelle Morgan. I lead the nursing work here at Johnson & Johnson and have the immense pleasure of working with all of these amazing people on this program. So super excited to be here and excited that we get to continue this great work together.
Thank you, Michelle. And obviously, we couldn't do any of this without your support and Johnson & Johnson's support. And Michelle's going to run through a few slides in a second. But before we do that, we do have a couple of our current fellows from this 2024 fellowship program on the call today as well, so that they are able to share their experience going through the program and answer some questions that we might not be able to. So I ask Beth and Jean. Beth, do you want to go first to introduce themselves?
Sure. Thank you, Mary. My name is Beth Baklovic. I'm the Associate Chief Nurse Executive for Ambulatory Services at Cook County Health and one of the 2024 Johnson & Johnson Nursing Innovation Fellows. So welcome.
Thank you.
Hi, everyone. Jean Zarenko. I'm the Chief Nursing Officer at Good Shepherd Rehabilitation Network in Allentown, Pennsylvania. And I am one of the current Johnson & Johnson Fellows as well, along with Beth and 8 other hospitals. And welcome and very exciting. Beth and I were in all of your shoes last year at this time, thinking about joining and applying. So I'm here to cheerlead. So
great. Thank you both. And honestly, for those on the call, feel free to ask them as many questions as you want, because, like they just said, they went through this program. They're going through this program right now. They were in your shoes a year ago. And, there's so much that we can tell you, but they're living it. And so there'll be a great resource for you to really understand what this program requires in terms of what time commitments and things that they're doing back at their institutions. I just wanted to give a shout out to our 2023 cohort. So as was mentioned, we had 10 institutions in 2024. We had 10 institutions in 2023, a total of 20 fellows each year. As some of you may have seen, we're increasing that this year, and I'll get into more details in a little bit when I go through the program specifics. But I'm going to let Michelle just talk to you about the amazing work that J&J does to transform nursing and healthcare.
Awesome. Thank you so much, Marion. And I'm not going to spend too much time here just because I know you guys are here really to get information about this specific program. But I did just want to take a minute to talk a little bit about why J&J has been supporting this program and other programs. And that really has to do with the fact that we have had a 125-year history of support for the nursing profession because we know that nurses are so absolutely critical to patient care, to functioning health systems, to health equity. And so for any of us to receive the care that is needed, quality, amazing care, nurses are absolutely vital. And so we really see ourselves as a champion of the nursing profession, and our goal really is to help elevate and advocate and see where we can help add value and provide support to the profession as a whole. So if you don't mind going to the next slide, Marion. And so, what we are focused on doing is really trying to help support an innovative, thriving, and representative nursing workforce empowered to advance equitable access to quality care. That's incredibly important to us. And we know that nurses really are the door openers for so much of that, and that work can't happen unless nurses feel supported and valued and have the tools and skills that they need in order to help create that thriving workforce. So we're really focused on 3 areas. One is really about championing and advocating for the nursing profession so that nurses feel recognized for the incredible value that they add as innovators and leaders and patient advocates. And then we're also really focused on what we can do to help equip nursing leaders to drive innovative solutions, really nurse-led solutions, to big health system issues, because we know that driving transformative change and transformative care really has to happen at that health system level. So this program is one of the great examples of the programs that we have under that strategy. And then our third strategy is really focused on how can we help increase diversity within the nursing workforce, both in terms of the students who are considering it as a career, as well as those who are in the current nursing workforce and are looking for leadership. What can we do to help foster and support that? Because we know that having a workforce that reflects the communities that they care for is incredibly important in terms of care and patient outcomes and improved health equity. So if you go to the next slide, I just wanted to flag quickly for you all a couple of resources that are all free and just want to make sure you guys are aware of it, can share within your network and tap into it as it makes sense. But we do a lot of storytelling, in part because we know it's incredibly important, not just to highlight some of the problems within the healthcare system and some of the issues that nurses face, but also really to highlight the solutions that are out there. And so that people can understand, how are people thinking differently? What is new and different in an effort to support you all as healthcare providers. So we've got a podcast that you can tap into on any platform, Spotify, Apple Podcasts, etc. A ton of great content there. Most recently, we did an episode on AI and the role in healthcare. And then this month, we're doing something around safety within the workplace. So just wanted to highlight, there's a ton of content there. Please check it out. We also have a e-newsletter that goes out, again, really trying to spotlight nurse leaders, nurse innovators, and the solutions they're coming up with to drive better work environments, better patient care, and what's really new and different. From a program standpoint, we've got this fellowship. Obviously, you guys know about it since you're here. We also have two other programs I wanted to highlight quickly. One is Nurse Hack for Health, which is an opportunity to have nurse-led teams go through an innovation process, and there is a pitch-a-thon that happens at the end of the year where there's funding available But if you've never been part of a hackathon and want to sort of learn what it's like and get an experience, sort of, get your feet wet, there are 2 innovation sprints that are a great place to learn that are coming up. One is at HIMSS in Las Vegas in March, and the other is at A1L, which is in Boston at the end of March. You can go to our website, nursing.jnj.com, to learn more. And to figure out where you can sign up, but it's just a great chance to sort of get exposure to the process and see what Nurse Hack for Health is all about. And then I wanted to highlight too, we have a new program that is launching this year that is called the Healthcare Workforce Solutions Academy. This is a partnership with AACN, American Association of Critical Care Nurses. This is more focused on direct care nurse teams. Versus the Nurse Fellowship, which is really about CNOs and senior nurse leaders. But it's another opportunity if that's a good fit for your health system. Again, all of this information is on our website. Applications for the Workforce Academy are open through February 21st, so definitely check it out if you feel like it's a place or an opportunity that resonates. And then we also are partnering with the CNO Institute. We've got 2 sessions happening this year. The March session the registration is closed, but the September sessions still aren't open yet, but they will be shortly. But it's a great opportunity. It's a 3-day workshop, so much shorter than some of these other opportunities, which are more year-long opportunities. But it's an opportunity, especially for diverse nurse leaders, to network, to learn about leadership and other skills that are needed as you look to advance your career. So just wanted to share all of that. There are a ton of resources, all of this plus more on our website. So definitely check it out, and don't hesitate to reach out to me if you have any questions. I'll put my email in the chat as well. Thank you.
Cool. Thanks, Michelle. I highly recommend checking out their website and all of the resources. They do a lot to support the profession. All right, so now while you all are here, I'm going to go through the basic overview of the program, all the different components and dates. We'll walk you through the application process, and then there'll be plenty of time for questions. I am happy to have questions as I go along too, so if I'm saying something and you need clarification, either put it in the chat and Nancy will flag it, or feel free to come off of mute and just ask. All right, so the Nurse Innovation Fellowship Program is a 1-year team-based fellowship that this year is going to run from May 2025 through May 2026. And again, I'll get into all of those dates. The fellowship is for chief nursing officers or equivalent titles and senior nurse leaders. So again, I will show this when we go through the application, but the lead applicant has to be a CNO nurse executive and have a senior nurse leader as a co-team lead. This is a program that's designated for innovative nurse executives who want to transform their specific hospital or health system with a focus on the healthcare work environment for your nurses. And so we will pick 2 nurse leaders from the same institution, and we are increasing it this year to include 15 different health systems. So we will have a cohort of 30 nurse fellows for the 2025 program. This is up from 10 institutions or 20 fellows from the 2 previous years. So we've seen a lot of interest and a lot of chief nursing officers and senior nurse leaders who want to participate in this program. And Johnson & Johnson is being, grateful enough to allow us to increase this program. So the teams will work together to address a real health or healthcare problem that you are facing at your institution. And again, the goal is really to advance healthcare by powering up nurse-led innovation and leadership within your health systems. So we're looking for problems that not affect patients directly, but that affect the nursing workforce at your institutions. And those are the problems that you'll solve over the course of the program. And I'll get more into that in a second. So this is the overview. We really focus on 2 things in the fellowship. We focus on the human-centered design process, and we focus on business skills specific to innovation. So the human-centered design and equity-centered design process is led by us at Penn Nursing, and then the business acumen and leadership skills are led by the Wharton Executive Program at Wharton. These are some of the business and leadership topics that you will learn. They are subject to change per cohort, but generally we focus on decision-making for leaders, strategy under uncertainty, strategic persuasion, and things like that, all taught by faculty at Wharton and all focused on healthcare and innovation specifically for this program. So these are the key dates and things to keep in mind. The application obviously is now open. It closes on February 17th, and fellows will be notified by March 21st. The program has a virtual kickoff in May, and I don't think I said this, but this fellowship is a combination of both virtual and in-person sessions. And so the first virtual kickoff will happen in May, and then our first in-person session will be in Philadelphia at Penn in June. The program will then have 3 virtual sessions, which will take place online throughout the year in September, November, and February. It says dates to be confirmed here, and Michelle, this is new news to you, but we are considering potentially switching up some of the dates, but more will follow in the next month or so. Regardless, the sessions will be in September, November, and February. And then we will have a final closing event at Johnson & Johnson's headquarters in New Brunswick in May. So this is just the same slide said a little differently. I do want to mention that all travel, all costs associated with the fellowship are covered again through the generosity of Johnson & Johnson's sponsorship of this program. So we will take care of all the arrangements for travel to these in-person sessions. All right. Any questions about the quick overview of the program? All right, well, there's plenty of time to ask questions at the end also. So in order to submit your application for the fellowship program, we use a platform called Submittable. So you can go to the website or scan the QR code. It'll take you right to the application page. You will have to sign up to log into the portal, and then you'll be able to click on this space that says Johnson & Johnson Nurse Innovation Fellowship, read the guidelines, and this is where you'll enter and submit your application. So there are a lot of requirements to be eligible for this program. You must be a registered nurse, reside in the U.S. or territories or Indian lands of federally recognized tribes of the United States. Like I mentioned before, you have to be a CNO or nurse executive in an acute care hospital or health system. This is a team-based fellowship, so you have to have another senior nurse leader participating in the fellowship with you. Really important, you have to have buy-in and support from your chief executive officer and C-suite. And as part of the application, and I'll go into this more, you also must have a signed letter of support guaranteeing release time for the in-person virtual sessions, but also stating that they will support the development, implementation, and sustainability of the innovation solution that you're going to be creating over this year-long fellowship. A number of other things, you can read them, but I also want to just highlight that you have to commit to the full year of structured learning, travel, and project activity that will be required during the fellowship. So as you're coming to these in-person and virtual sessions, learning about the human-centered design and design thinking process, you will then be going back to your institution and working through a real project at your institution using the different human-centered and business knowledge and methodologies that you will be learning during the fellowship. So this is a very time-intensive, active learning fellowship where you'll be learning at our virtual and in-person sessions, but doing the work with your teams back at your institutions. All right, so as part of the application, you will, commit to all of that for eligibility, and then you'll go into the actual application portal. So the primary team lead, who has to be the chief nursing officer or nurse executive, will create the application, and then you will invite your co-lead to join you on this application. So you'll just click on Manage Collaborators. You'll enter in their email address, and then they will have access to the same application that you are working on. So you can complete this application together. It'll first ask for the primary team leads, demographic information, educational information. Then it'll ask for the secondary team leads, demographic and educational information. You'll fill out all of that information, and then you will get to the essay part of your application. Again, one application per team is all we need. So there are a number of essay questions that you will be asked to complete. This really is the part that we focus the most on in terms of trying to select who will best fit the fellowship. So we really do want you to give these essay questions a lot of thought when you're completing them. Just as a note, you don't have to complete all of this in one sitting. You can save it and come back to it as you need to. Just make sure you hit the save button before exiting the portal. This is just something to note. It doesn't automatically save like Google Docs or some other programs. So you do have to physically hit save when you're in this portal. As part of the application, you have to upload each of your CVs or resumes, and then, as I mentioned, a signed letter of support from your CEO or equivalent at your institution, signed and on letterhead, stating that they're committing to, again, providing your team attendance at all of these sessions and supporting the work and implementation you're going to be doing during the fellowship. And then you will submit the application and be good to go. As part of the fellowship, and we can answer more questions around this, but after each virtual session, we are doing a lot of collecting and monitoring of data. So you will have a number of surveys that you will be asked to complete. This is a condition of being accepted into the fellowship program. So we do want to just make sure that everybody is aware that you will be reporting out on all of your experiences from start to finish of the fellowship program. And we do continue to monitor the implementation of fellows projects at 6 months and 1 year after the program as well. So you'll go through this 1-year fellowship, but we will still be in contact with you a year out from when you're done with the program so that we can monitor and assist with whatever implementation needs you may have. And so you can check out our website. There's a lot more information around frequently asked questions as well. And we add more questions on there as they come up from these info sessions. So that page should be ever changing. This information session video, along with the slide deck, will go up on our website as soon as we can get it up after this first of many info sessions. And so with that, I will stop sharing and we can answer questions. And again, we have our consultants on, we have fellows on, so please ask as many questions as possible. I don't think I did a great job explaining what happens between sessions of the fellowship. So maybe that's where Beth and Jean, maybe you can jump in for a minute and just describe what the actual work in process looks like of the fellowship.
Sure. Hi, everyone. It's Jean. I can go. To Marion's point, the work does not stop, after you leave those virtual and in-person sessions. It's really about trusting the process, that you learn about human-centered design, and also engaging your team to come up with a solution. So, the one thing that I would say is that the time commitment, I can't even, and Beth, jump in, I can't even begin to describe how intense the time commitment is. So the program is just amazing. We do have a lot of fun when we're together as the cohorts. Marion and Nancy and Michelle make sure that we have a lot of fun, but it is intense while you're in the in-person sessions. It's intense when you're in the virtual. You really cannot be multitasking when you're on the virtuals. You've got to step away from your job and really devote 100% of your attention to learning the process, and then really learning to engage your team with whatever solution that you might want to address. So, and Beth, I don't know what you.
Absolutely. So just to chime in on it, it's been an amazing opportunity. I've never felt that I was alone on a major project. We've always had Marion and Nancy and Michelle and our team there. And to start off together with that June session really helped us bond with all of our cohort members so that we understood and can support each other through the process. Bringing it back to your organization is critical, and using that human-centered design, it engages your leaders, it engages those frontline staff that you're working with and everybody that's part of that project. And so it's been wonderful at really building that team back at the organization. They've also become part of this and have been able to do some of the readings and share in some of the virtual sessions, which has really helped them to understand more about that human-centered design. And so this is a springboard, if you will, a great opportunity to learn something, to make something as an improvement, to see something grow, to build your team, and then understand that this is just the first of what might be many as these projects come up and as people get more and more engaged. But each one of those virtual sessions was critical, and it's a chance to kind of show off what you've done and to make sure that you're on target and hear what other people are doing as well. So the virtual sessions, as Jean had said, critical. You can't really multitask. You have to be present and in the moment. But it's also enjoyable and satisfying when you see where you're at and where everybody else is at throughout the year.
Thank you both. I did forget to highlight how much fun we all have as a group. So our first in-person session is a 5-day innovation intensive in Philadelphia. And yes, you will be learning a lot, but you will also be meeting a tremendous group of people. We do a lot of socializing, I think a lot of laughing, and try and keep it as much fun as educational. Hiam, you're on too. Do you have anything to add?
Hold on, sorry. I know, first of all, I want to apologize. I can't get my camera to work because my kid probably did something to it and I can't figure it out. But yeah, and I mean, I've been doing this for several years, and every year I still learn a lot from the week intensive courses, but also from each of you and all the pain points and all the things that you're trying to solve. I really, really encourage you to apply. I think it's, I don't know, something in a lifetime to apply for.
Cool. And with that, does anybody have any specific questions? I did get one in the chat that I can bring up while other folks are thinking about their questions. And Michelle, this might be one really for you, and maybe we need to discuss offline, but someone asked if, so they work in an acute behavioral health system that includes inpatient psych and inpatient detox and rehab residential. Would they qualify? It's not something we've discussed before, I don't believe. So I wanted to run it by the group.
Yeah, it's a great question. I mean, I could see that being okay. I think our end goal is really to try to help provide the support and the catalyst to drive change so that nurses, that are operating within health systems generally, but, in these types of structures where, there tends to be broader patient access and opportunity for impact. So I would think at a surface level it would be okay. I think as part of the application, I know, if I'm correct, Marion, it's still in there. Part of it is like you describing your health system and sort of the structure and all the rest. So I think there may be more detail that comes up, but I think at a high level, as long as you're part of a health system and there's an opportunity to drive change more broadly, I think the fact that you guys are focused on behavioral health and psych is fine.
Great. There's another question in the chat for Beth and Jean. I just got bumped. What was the project you chose to work on and why? And maybe you can talk through the human-centered design process and how you got to that.
Sure. I can go first with this one. So I am at Cook County Health, a major organization in the city of Chicago, encompasses all of Cook County. And our project was focusing on, we have two hospitals. And so our main or our flagship hospital is Stroger, but we have another hospital, Provident, which is a small hospital. It had been closed for several years, and we've been reopening it and expanding. We were looking at a lot of issues that we thought were issues initially around staffing and supplies, and what the staff were saying was a problem with Provident. It's located in a demographic area where there is a very low income, poor insurance, poor health, lower socioeconomic area. And so we went there thinking that our design was going to be talking about the staffing plan on their med-surg unit, their critical care unit, and the ED. And so we really thought this was going to be about staffing. But the human-centered design, as we put the questions together, what we learned back in Philadelphia when we were there was to not assume and to ask questions, to open it up, to really see what people had to say. That's the whole point of the human-centered design. It's not us as the humans, but it's that human-centered design around the staff that we're trying to help. And so we did these interview questions and we left them pretty broad. What does a really good day look like? What does a really bad day look like to you? What do you love most about your job? And we created that persona of Patty the Provident nurse. And it was through that human-centered design we found it wasn't about staffing, it wasn't about supplies. It really was about communication. And communication is one of those problems. We know, I think they had said something like there's $12 billion that are spent every year on failure to communicate. And there's a lot of medication errors around this. And so it stemmed all to that communication issue. Now, we kind of thought this was going to be a lot ambulatory as well as inpatient, because I'm the chief nurse for ambulatory, but it really was more communication between the ED and 8 West. Great project. It's on communication. We are working on, and we have our prototype, and we met with the staff just this week and we went through the prototype step by step by step. We ended up with a 3-prong approach. And the staff absolutely loved it. We started off with our problem statement again. We had all of the 8 West staff and a couple of the ED staff there. And we're like, are we on target? And they were like, absolutely, this is great. And then we talked about the 3 approaches. We're going to have 1 documentation in our system, 1 in a dashboard, and 1 in an app that we're going to be using. And as we went step by step, they really appreciated us taking the time with them. They were thrilled. We got our picture taken with one of our big displays. And so keeping in mind when you're doing that initial interview phase, when you're really looking at empathy and what it is that they're asking, was important. And so our shift changed, or we shifted to that communication model. And it is very exciting. It's not going to end right at May. It's something that continues on, but we have the commitment of the organization, the support of the organization, and we're looking at methods to continue this process to get it up and running. And then maybe even to have something that can be commercialized. And so it's really exciting, but right now the staff are thrilled.
And do want to say that as part of the fellowship program, you're not alone. It's not like you come to these sessions and then you're doing the work by yourself. I do check-ins with the fellowship teams regularly. We assign mentors to the fellows, which you all will get your fellows soon, your mentors soon, who have expertise in the area of the solution that the fellows are creating. We have consultants on the team, so Hiam, Kate, and Inoki, who you will meet if you go through the program. So, we do try and provide as much support as you all need to make sure that you are successful in creating and implementing a human-centered solution to the problem that your end users, whoever they may be, are experiencing at your specific institutions.
And Marion, I'll just share on the Good Shepherd side. So we actually focused on discharge planning. We actually looked at what our data was telling us on Press Ganey, and we are an acute inpatient rehabilitation hospital, and we weren't quite moving the needle in the way that we wanted to on our patients. Giving us positive feedback about the discharge planning experience. And like Beth, when we did the empathy modeling with our team, and I think as nurse leaders, we immediately get a problem and we think we have to just come up with a solution. And it really, again, if you do get into the program, you'll hear this over and over again, trust the process. You really need to step by step go through the human-centered design. And the other thing is, very often when you hear innovation, everyone immediately thinks technology, and you don't necessarily have to come up with a technological solution. It's really about understanding what your team needs. And when we interviewed our nurses, we recognized that while we have a very strong interdisciplinary team, PT, OT, speech, physician, nursing, that we weren't collaborating as well as we needed to get our complex rehab patients home. So that was sort of our methodology here at Good Shepherd and what we went after. And again, to Marion's point and to Beth's point, you are not alone. You do have to be open to constructive feedback because, and also when you do your application, and Marion, I don't know if you mentioned this, I do remember this last year. You are going during your application to suggest what your problem might be. You may not be doing that problem when you get into the program because you start to learn different things about yourself, about your organization, and about the needs of your organization. So again, Marion did say hashtag trust the process. It really is incredibly valuable. It made me think differently as a chief nursing officer about how I approach other problems, not just the one we're trying to solve during the fellowship.
Thank you both. I appreciate those clarifications. I got two direct message questions that I want to share with the group. One was just clarifying there is no tuition or cost to the participants. All of the expenses are covered again through the support of Johnson & Johnson. And then someone asked, when you say senior leader, is there a minimum position such as director? So we try not to have blanket statements on this because we understand that every institution has a different structure. So within your application, there's a spot to describe who your leaders are and then to upload an organizational chart. That will help us determine if it's a high enough level because titles don't always describe what everybody does, and each institution has a different structure. So I can't blanketly say yes or no. What I would say is just be clear in your application, and if you can, to upload an organizational chart. That is really helpful. Let's see, have other questions come in?
Yes, there's one from Ryan in the general chat.
Ryan, do you want to come off mute and ask it?
Yeah, sure. Yeah. Well, thank you so much for sharing this information about your projects and your experiences. Could you just provide a bit more information about what you might be expecting at the application stage when it comes to describing the problem and the potential solutions?
Yeah, so, like Jean said, we're going to ask you what you think the problem is that you want to solve. We're just trying to get a sense of what folks are dealing with and what you might want to try and create a solution to. But as a part of the program, again, as was described, you're really going to be talking with your end users, the folks who the problem actually affects, to understand what really is the problem. And so you might have an overall sense of an area you want to try and work in, but you're going to dig down even deeper to find what that root cause of the problem is, and that could potentially be the problem you're working on. So I don't know if that was so clear, but like we're just trying to get a sense of the bigger problems you all are thinking you're going to focus on. And then as you go through the program, you're really going to whittle down, and it may still stay in that same area, but as was mentioned, it may not. It may go in a completely different area direction, and you have to be open to that. That's what we mean by trusting the process, listening to your end users, and working through this human-centered design process to make sure that the problem you think you have is actually the problem that your population is experiencing.
And the problem should be not patient focused, but focused on the nursing professional experience.
Yeah, and workforce.
Yeah.
Yeah, and Nancy, that's an excellent point. And Ryan, our example, we used our discharge planning Press Ganey results to help us understand, what our nurses were going through, and it aligned with our outcomes, structure, process, outcome. So we're hoping that improving the discharge process for the nursing staff will ultimately positively impact patient care.
Other questions? Craig, I see your hand is up.
Hi, thank you. Craig Tobias. I'm the CEO of Cleveland Clinic Avon. Just thinking of my sales pitch to the CEO here and say, I'm going to spend this time and effort and do this. Obviously, Johnson & Johnson, thank you, bears a lot of weight on its own. From the fellows that are already in, if you had to go and deliver this sales pitch of how you're going to spend your time working on this project, I'm curious how you would go about that.
And before they answer that, I will just say that that is a requirement of the program, that as you're going through the program, you are keeping the CEO updated of the work that you're doing, the project you're working on, the solution you're creating, because it is an expectation of the program at the end of the program to have a low fidelity prototype, minimally viable product to test and implement at your institution. But Beth or Jean, do you want to answer that?
Sure, I can start off first. So I think it's very effective to have that chief executive as part of that team, because they have those one-to-ones with the CEO. And so I think that's important. The main point is that when you're doing the legwork on your project, you're looking for evidence-based practice out there and what has been done, what is the impact of what you're trying to do, and how are you going to measure it? And so speaking in terms of the savings or the amount of money that's spent, for example, as we're looking at the communication, we identified a couple of inefficiencies with communication from the ED to the floor. and time spent waiting to get a patient up there, and the impact it has on patient satisfaction. And so in planning out for this, Johnson & Johnson has this wonderful layout of the virtual sessions, and they're going step by step, and then the on-site sessions. And so you're planning your time in between these, knowing of what your goal is for the next session. And then based on that time and what the project is, looking at what the evidence is out there of cost savings, kind of an expense, revenue and expense sheet. So you want to have some type of a sheet to help identify the impact of what you're going to have and why this is so important. There has to be some flexibility, and as Marion said, the CEO often they have to sign that letter for flexibility. But it does seem to fit perfectly between the virtual sessions. Jean,
Yeah, and I would just, Craig, add also, I was fortunate enough that the CEO here at Good Shepherd is very pro innovation. But I think to your question, what value does it bring? What value does it bring to the organization? What value does it bring to the nursing department? And whether it's cost savings or improved nursing engagement or reduction in turnover, all of those things that strengthen your nursing workforce, I think would make it, valuable to your CEO. But that's really, and again, to your earlier question, and my earlier statement, the time commitment is huge, and your CEO has to be willing to release you. Did you say you're the CNO? You and your nurse leader, because it is time intensive, but the return on investment, I can't stress enough, from a succession planning and just from a quality and value to your department of nursing, I think is unmatched.
And one thing I don't think I mentioned, but even though we're selecting, two senior nurse leaders from one institution, it is a team-based fellowship. We do highly, highly encourage, recommend that any other healthcare providers, other team members from your institution who are going to be working on this problem with you, that they attend all of the virtual sessions, that they are given all of the educational material, and that they work through this project with you, so that it's not just two people in an institution receiving this education and being able to create this innovative mindset, but whole members of your team. And we've had institutions in this current cohort and in the previous cohort bring 20 people from their institution to each of the virtual sessions. Now, obviously, we can't have them come to the in-person sessions, but they are encouraged to come to all of the virtual sessions and to receive all the materials. So it's an added bonus that your other staff members and clinicians are getting this type of education and training also from Penn Nursing and Wharton.
And if I may just add on, Marion, I think those responses were fantastic, and I agree with what you said in the chat too. That I think, Craig, part of it, we've been really thoughtful about this because we do want this to align with your organizational priorities, because that's where we see the sustainability of the ideas, being fostered. Like if it's not something that the CEO is aware of or the executive committee understands or supports, it's not going to get the longer term integration. And I think for a couple of things, one, we want to make sure we're helping to advocate for nurses as solution finders, not just to nursing problems, but to broader health system problems. And so trying to raise the visibility of the opportunity here for you guys to come up with solutions, I think is incredibly important. And then to have that buy-in so that you guys have the chance to have, the conversations, the resources, additional staff, as Marion mentioned, participate in this. I think that's where the opportunity is to drive change. And so when we originally started this program in the very first inception, it was very individual nurse focused, and we are really trying to find ways that we can help scale impact. And a lot of what we heard is that you can do a lot of support to individual nurses, but if the system in which nurses are operating doesn't shift and change and improve, then you're not going to get that sustainable, thriving nursing workforce, which then results in better patient outcomes and better ROIs for the health system. So that's really what we're aiming at, is like, how can we help energize and empower you all through all the incredible networking you're going to get through this, and through the incredible learning of Penn and Wharton, so that you guys have the opportunity to really drive change in your institutions.
And I will say, to stress this point, we did include a new question in the application asking how you're going to align the work that you're going to do for the fellowship and the, again, the overall problem you'd like to solve with institutional priorities, so that when you get to the end of the fellowship, there's a much greater chance of system support in implementing and sustaining your solution. Other questions, and while people are thinking of that, someone did ask, and I did not stress this, but this fellowship is only for US-based nursing and healthcare institutions. So at this point, as part of the requirement, you have to be at a US-based hospital or health system.
There is another nursing innovation opportunity that's international, which is called Nurse Hack for Health. I'll put the link to that in the chat.
Yes, and Michelle did mention that as one of the other programs that J&J supports. All right, well, if there are no other questions, please feel free to reach out to us directly if you have questions that come up. Like I mentioned, we will put this information session video up on our website along with the slide deck. So if other team members at your institution want to review it, they can. We will have other information sessions coming up over the next month. Those are on our website as well. Nancy, can you throw our website link in the chat?
Yep, one sec.
I'll throw our general email in there that you can email us at, and we want you to be successful. If you're going to apply for this program, we really want you to be successful. So please reach out if you have any questions, and we'll do our best to help walk you through it. Thank you all. Beth and Jean, thank you for being on. Really appreciate it.
My pleasure. See ya.
Bye.
Bye.